Hello, today we will be talking about normal situs as well as concordant versus discordant atrioventricular connections and arterioventricular connections. We'll start off by talking about normal situs, which is performed in the second and third trimester of fetal echo. In normal situs, the stomach, spleen, and aorta is on the patient's left side, and the liver, gallbladder, and IVC is on the patient's right side. There's also situs inversus, which is a mirror image of this arrangement. In this, the stomach and spleen are on the patient's right side, the liver and gallbladder are on the patient's left side. There's also situs ambiguous, which means the liver is midline and everything else is scattered around it. Next, we will be talking about cardiac positioning. In normal cardiac access, the interventricular septum is 45 degrees from the midline. The heart is on the left side of the patient and the apex is pointed towards the left side of the patient. When the apex is pointed towards the left side of the patient, this is known as levocardia. There's also dextrocardia, which means that the apex is pointed towards the right side of the patient. There's also mesocardia, which means that the apex is towards the center of the patient. Next, we'll be talking about positioning. In levo positioning, the entire heart is moved to the left side of the patient, with the apex still pointed to the left side of the patient. And there is dextro positioning, which means the entire heart is moved to the right side of the patient, with the apex still pointed to the patient's left. Now, we can have combinations of the positionings and the cardia. For example, we can have dextrocardia, where the apex is pointed towards the patient's right, and levo positioning, where the entire heart is moved to the left, as well as dextro positioning, which means the entire heart is moved to the patient's right, and the apex is pointed towards the patient's left. Next, let's talk about concordant versus discordant atrioventricular connections. In this is the right ventricle, the left atrium, and the right atrium. This is an example of concordant atrioventricular connections, where the right atrium matches with the right ventricle and the left atrium matches with the left ventricle. There is also discordant atrioventricular connections, where the left atrium is connected to the right ventricle and the right atrium is connected to the left ventricle. Next, let's talk about arterioventricular connections. In concordant arterioventricular connections, the aorta comes off of the left ventricle and the pulmonary vein comes off of the right ventricle. In discordant ventricular arterial connection, the pulmonary vein comes out of the left ventricle and the aorta comes out of the right ventricle. There are different types of this. For example, situs inversus totalis is just completely normal. In this, the right atrium matches with the right ventricle, the left atrium matches with the left ventricle, the aorta will still come out of the left ventricle, and the pulmonary vein will come out of the right atrium. Or the right ventricle, excuse me. In type 2, there's a concordant atrioventricular connection, meaning the right atrium is with the right ventricle and the left atrium is with the left ventricle. However, a discordant ventricular arterial connection, which means the aorta will come out of the right ventricle and the pulmonary vein will come out of the left ventricle. In type 3, there is discordance in both types. This means that the left atrium is connected to the right ventricle, the right atrium is connected to the left ventricle, the pulmonary vein will come out of the left ventricle, and the aorta will come out of the right ventricle. However, this is also known as congenitally corrected transposition of the great arteries. This means everything will still be okay because deoxygenated blood will still get to the pulmonary system and oxygenated blood will still be sent out to the rest of the body. The fourth type is very rare and it's atrioventricular discordance. So like how it is with the left atrium connected to the right ventricle and the right atrium connected to the left ventricle. And then ventricular arterial concordance, which means the pulmonary vein still comes out of the right ventricle and the aorta comes out of the left ventricle. Thanks for listening. That's all I have today.